So let's start with the definition. What is a POD? The post-operative delirium is a status of acute mental confusion after anesthesia and surgery. The incidence of the POD is pretty high, and it is even higher in the ICU. Patient with delirium has more than 12 times possibility to develop Alzheimer's disease. Older patients are more vulnerable to the develop POD than young patients. However, the underlying mechanism is not well understood. That's why we don't have effective intervention at this moment. Gut microbiota dysbiosis is a status of microbiota imbalance inside the gut. It can change the immune system function and also the central nervous system function. Aging is associated with a change in the gut microbiota and the microbiota dysbiosis. Our previous study shows that anesthesia surgery cause age-dependent gut microbiota dysbiosis and the POD-like behavior in mice. Meanwhile, anesthesia surgery induced the blood-brain barrier, the BBB dysfunction. So that's why we hypothesize that anesthesia surgery can cause age-dependent microbiota dysbiosis and the BBB dysfunction, leading to delirium-like behavior in mice. Here we use the female 3 months and 18 months old mice and give them abdominal surgery under anesthesia for 2 hours. We determine the delirium-like behavior using battery of new nature and learned behavior tests in the mice. We assess the BBB permeability by using dextrin and also the interleukin-6 levels in the brain using LASA. And for intervention study, intragastrial administration of a probiotic was used to rescue the anesthesia and the surgery-induced above change. So let's look at the results. In figure 1, the left form is telling us what kind of change can caused by anesthesia and the surgery in 3 months and 18 months old mice. Moreover, the compromise Z-score can telling us, compared with the 3 months old mice, the 18 months old mice have even higher Z-score. If you are not familiar with the meaning of the Z-score, you can just simply think that the higher Z-score you got, the more severe delirium it will be. And for the figure 3, image study is showing us green indicate the blood vessels, and the red is indicate dextron, which is injected from the mice tail vein. And in normal condition, so in the normal condition, the dextron should be inside of the blood vessels. However, if the blood vessels got damaged and the dextron can leaking from the damaged the BBB and get into the brain tissues. So that's why here we can see that anesthesia and surgery can cause a higher BBB permeability in 18 months old mice compared with 3 months old mice. Finally, in figure 3, the treatment with probiotic can rescue the anesthesia and the surgery induced the change in delirium-like behavior and also the BBB dysfunction. It can also rescue the brain interleukin-6 level after the probiotic treatment. So according to above data, we can have a quick summary. Pending on further investigation, the anesthesia and surgery may cause age-dependent BBB dysfunctions through the gut microbiota dysbiosis, which then lead to the increase of the brain interleukin-6 levels and also the pathogenesis of the POD-like behavior in mice.